Okay, good morning, everybody. Thank you so much for joining us here today. We really appreciate it. This is the informational webinar for the second annual Pediatric Capacity Building Institute. You're here because you are interested in learning more about this institute and how to apply and express your interest and participation for next year. So we'll do a little introductions on the faculty, and then we'll move into the content. My name is Jonathan McVeigh. I work out of the Secretary's Office for the Pennsylvania Department of Human Services on complex needs planning, and I'm going to hand it off to Paul.
Hey everyone, I'm Paul DiLorenzo. I'm co-directing this with John. I'm a consultant to the Pennsylvania Department of Human Services.
Thank you, Paul. Emily?
Good morning, everyone. My name is Emily Berger, and I work with the Office of Developmental Programs, and I'm the Special Populations Clinical Support, and work with John on children with complex needs and PCBI.
Thank you, Emily. Stacy?
Good morning, everyone. My name is Stacy Gildepepa, and I am a program rep for the Northeast Regional Office of Youth and Family Services.
Thank you, Stacy. Shay?
Good morning, everyone. This is Shay Earhart. I work for the Office of Mental Health and Substance Abuse Services, and I am the Director of Operations for the Bureau of Children's Behavioral Health Services.
Excellent. So the two other individuals on this list are not on this call, so I'll just briefly mention them. Robin Levine is with the Columbus organization through a contract in the Office of Developmental Programs. She is the Institute's curriculum coordinator. And Sharon Kennedy is with the Pennsylvania Training and Technical Assistance Network. Some of you may recognize that as an arm, a training consultant arm of the Department of Education. So what is the Pediatric Capacity Building Institute? Robin Levine, the Institute's curriculum coordinator, is also the curriculum coordinator for another program called the Adult Capacity Building Institute, or just the Capacity Building Institute. They have been active for about 8 years now. I think they're entering their 8th year. And it is focused on individuals, adults with dual diagnosis, with intellectual or developmental disabilities and ASD, and behavioral health challenges. The goal of that program is to build capacity for people serving and supporting those individuals. This Pediatric Capacity Building Institute is modeled after that. We are standing on their shoulders and using a lot of their successes and building upon that for the benefit of the child serving systems in Pennsylvania. So it is an in-depth, educational, and interactive experience for participants. It is 18 sessions over the course of 9 months, so there's 2 days per month. And the programming for year 2 will go from March of 2025 through November. We do have a backup session scheduled in December, just in case there's inclement weather or we have technical difficulties or something else that causes us to cancel one of the sessions. The focus of the Pediatric Capacity Building Institute are children, youth, and young adults, so ages 0 to 21, who have complex needs, and their families. You may be asking yourself, who are children, youth, with complex needs? I'm guessing that most of you here already have a good idea of that. The way we, the Department of Human Services, describes them are, we have a series of kind of characteristics that we say, these are the most often encountered characteristics that we see in children and youth with complex needs. That includes children and youth with complex trauma, abuse, neglect, developmental, institutional. Many of these children and youth also have multiple and complex diagnoses across the developmental, physical, and mental health domains. They also frequently experience diagnostic overshadowing due to their intellectual disability or autism spectrum diagnosis. Frequently have complex communication needs, inconsistent presentation across different settings, leading to a lack of diagnostic clarity. Very frequently, they experience disrupted education. They have limited, strained, or no natural supports often. And as a result of all this, very frequently experience multi-system involvement, including justice systems, and an extensive history in out-of-home care. So those are kind of the most often characteristics that we encounter, and that's how we generally describe these children and youth. But we absolutely have to recognize that every single kid that we support and serve is unique. And so not all of those characteristics are required for them to consider a kid with complex needs, but that's just generally how we try to identify them so that we understand who we're talking about. So I'm going to hand it off to Paul here to tell you all a little bit about the goals of the Pediatric Capacity Building Institute. Paul?
Thanks, John. Well, if all of you are here signed up this morning, you know a little bit about this whole area, this subject. But the goals of the Pediatric Institute are narrowed in on a couple of very specific things. Kids and young adults and their families often face significant barriers. Frequently, they get caught up into a system that spirals the wrong way. And there are a number of barriers to treatment, to the supports that kids and their families get, to the services, and ultimately to living their everyday lives. And of course, in your work, you're trying to make sure that kids and their families have the most successful outcomes possible. So one of the things we're trying to accomplish with the Pediatric CBI is to make sure that people understand what some of those significant barriers are to getting the services and the supports that they need. One of the primary goals is to increase your administrative and your clinical capacity across all systems. Those kids who frequently touch a variety of different systems, and then also making sure that we not only build up your clinical knowledge of the young people and their families, but also your administrative ability to understand how to create some system improvement or even systems change at the local level. The next slide, John. The participants in this project are going to strengthen their clinical knowledge and the understanding of the young people and their families. In our first iteration of this, we spent a lot of time talking about some of the clinical therapeutic issues that face kids and their families, and an understanding of how best to address those with the resources that are available now, but then also with the possibility of creating others through coordination, collaboration. The other goal here is to utilize the knowledge that you gain through this project, not only to strengthen, but to improve and to even create programs and approaches that may more effectively support these kids and their families. So we're not looking to ask you to sit through 9 months simply to maintain the status quo, but really to improve your personal knowledge, but also the knowledge and the capacity of your systems to do things in an even better way. We want to increase your understanding of the best practices, the promising practices, and the approaches to complex needs planning. And there are a lot of good examples of this where jurisdictions, sometimes smaller ones, some of the larger ones, have created best practices. Perhaps they borrowed those from other places around the country and applied those to that complex needs planning. The PCBI will give you an opportunity to learn some of what those are, and then to how to tailor them to your specific jurisdiction. And on to the last slide, John. And then the other goal is to spend some time strengthening your engagement with your local constituents of people with lived experience, making sure that families, young people who've lived through this experience, et cetera, are part of the planning and the decision-making process. This is a critical component of the work. It's not necessarily a new idea, but certainly one that we think continues to need strengthening and enhancement. We want you to have an improved understanding of each other's systems, the available resources, the process, the policies, how to access those services, what are some of the rules and the funding, both challenges and opportunities. Our first Pediatric Institute, we've put a lot of time and energy into getting people to understand how one system interacts with another, or perhaps if it doesn't, how to make that happen, but then also to understand what are the policies for referral, for accepting services, and then also the funding streams that make all of this possible. And then finally, one of our ambitious goals is to make sure that we can create a network of people throughout the Commonwealth who understand what the complex challenges are, but also the opportunities, and then maybe even a learning collaborative, a way for you to reach across counties and to talk with your peers who participated in the PCBI. What have you done? What's working? What isn't? What could we do to fine tune the work that we're involved with right now? So at the end of this, that 9-month time, we're hoping that we do have a peer network that will not only enhance your local work, but also the work across Pennsylvania. Okay, John, turn it back to you.
Thanks, Paul. And you'll be joining a class of other alumni as well. So there's a current, class who is about to graduate next week, and so you'll be joining them as well as part of that network. And so just wanted to emphasize that part as well. You're going to be in the room with people you wouldn't otherwise get to interact with on a regular basis with. There we go. So in terms of topics, the curriculum, this is an evolving process. We learned a lot from the first class. We have feedback surveys that we conduct after each session, and received a lot of feedback and even evolved the curriculum as we went. So right now we are in the process of working through the curriculum for year 2, but generally these are the topics that will be addressed by subject matter experts and through learning here. So we have infant mental health, child development and attachment, trauma, vicarious trauma, cross-system knowledge and multi-system planning. That was a particularly popular one with the year 1 class. Resiliency, early intervention, and education in non-educational settings. We'll also explore psychiatric diagnoses and psychopharmacology, communication and sensory needs, therapies, services, program, evaluations, and assessments, understanding the child and family. That should say understanding the whole child and family, a biopsychosocial approach. And last, but certainly not least, relational health and permanency. So we will use various tools throughout the process. It will not be a strictly somebody standing in front of you and lecturing you. It's not Socratic method like law school or anything like that. We strongly encourage all of the presenters to actively engage participants. We want to have a dialogue with you. There will be breakout sessions. We'll have small group work, large group work. So there's a variety of different mediums and tools that we use to address these topics. We really want to have an interactive discussion. Paul, is there anything you would add about that?
I would, John. It's something that you just said. I think one of the things that we found out pretty quickly in the first go around with this is that the local experts and some of the state experts were in the room, right? They were people who had signed up and who were participants in the PCBI, but they brought a great deal of expertise to this. And this really gets to the heart of the learning process for the Institute, which is, it is, as John said, highly interactive. It depends not only on the person in the front of the room presenting, but also making sure that we engage you as experts, because of the content knowledge, the experience, the professional background that so many of our participants had was pretty compelling. So we think of the folks who participate in this as the state and local experts, as well as the person in the front of the room who's doing the presentation.
Thank you, Paul. So I kind of touched on some of the aspects of this slide here. The success of this institute does depend on the active involvement of all participants. All participants play a diverse and pivotal role in the success of this capacity building initiative. And regarding the diverse and pivotal roles, I just want to describe very briefly who all is invited to this. This went out very broadly. We sent it out through the Office of Mental Health and Substance Abuse Services, Office of Developmental Programs, Office of Children, Youth, and Families. I sent it out through the Pennsylvania Department of Education, and as well as the Executive Director, Don Corey, of the JPO Chiefs Association. So very diverse group, and ideally we'll have representatives from child welfare, mental health, IDA, education. We'll have behavioral health MCO representatives, county administrators. We'll have multidisciplinary people there, folks who are clinicians, social workers, caseworkers, physicians, policy wonks like myself and Paul. So it'll be a very diverse group of people. And that, I guess I want to also emphasize that in context to the networking opportunity that's presented to you here. So you all will bring a wealth of knowledge and experience to this group, and your active participation will ensure a rich experience for everybody. This last bullet, I just want to give a nod here to, and this is a group project that you and your peers will work on throughout the Institute, and it will culminate in an opportunity at the last session to engage with Department of Human Services leadership, the secretary, deputy secretaries, and others during the graduation. And then later that second day, you will also be presented with a certificate of completion after the 9 months is up. So session dates, these are outlined.
Let me just mention, and I think you're going to mention it again, but it's really important to say it a couple times, which is the active participation of people in all of the sessions is really important. We know that things come up that people might not be able to get to every one of the sessions, and John's going to talk about those dates now, but the idea of being a full participant and committing to this makes all the difference, not only for you, but also for the richness of the group, since so much of the learning experience will be a shared one.
Absolutely, Paul. Yes, thank you. So these are the dates. These are outlined in the these are outlined in the invite that went out yesterday. Please, I would recommend you go ahead and mark these off on your calendar. We did our best to avoid conflicts with other like annual events like conferences and things like that. However, there will occasionally be some conflicts for some of you. So we did our best to navigate that, and these were the best dates that lined up for the most. In terms of schedule, the daily schedule, day one is usually a Wednesday, and we meet at 10 a.m. We start at 10 a.m. sharp, and we will proceed until 4:30. We start at 10 later in the morning to give people time to arrive and kind of get settled and things like that, as I know many of you will probably be traveling from other places in Pennsylvania. Day two, we start at 8:30 and conclude at 2:30. Again, the early afternoon dismissal is to reflect time for people to travel. And very importantly, there will be food and refreshments. So AM and PM, there will be coffee and tea service as well as light fare. And then we will have a lunch scheduled every session day. Dinner is on your own though. So between Wednesday and Thursday, you get out at 4:30 on Wednesday afternoon, you're on your own for dinner. Although one of the pieces of feedback that we did receive is that participants would like an opportunity for maybe an occasional mixer or maybe happy hour or like a get together for dinner. So we will plan to do that as well. It's kind of an additional get to know you opportunity and networking. We are going to be located in Harrisburg for year two at the Patton offices in Harrisburg. It's actually outside of Harrisburg, about 10 minutes or so. So you don't have to deal with parking or anything like that downtown. There is free parking on site. Please feel free to check out the Patton website link that I included in the invitation. To be considered for participation for year 2, you must submit an interest survey no later than October 9th. There was a link included kind of toward the bottom of that invitation that went out yesterday. Please click that link. It's a Microsoft form, fill out the information and hit submit. All submissions will be reviewed and participants will be notified of their selection status by November 1 of 2024. There is a registration fee that will come later after you have been identified as participating. The registration fee will be approximately $600 to $900. We are waiting for an initial estimate from the caterer. As I mentioned a moment ago, this registration fee covers the lunches, snacks, and beverages. Payment must be received before the first session in March. And then the final details regarding that registration will be shared after the final headcount is established. Regarding hotels in the area, there will not be a block of rooms reserved. There are several hotels in the area that Patton has listed on their website. If you click that link in the invitation and scroll down, you will see a list of local hotels. They're all within 10 to 15 minutes. I wouldn't even say 15 minutes, probably 10 minutes of the meeting site. And I am told that if you tell the registrar at the hotel that you are attending a Patton event, they may give you a reduced rate. So please feel free to book wherever makes sense for you. So just a few final points. I mentioned the survey that goes out after every session. We really want your feedback on this, through each session. Please complete. So just not to confuse things, there's the interest survey to apply by October 9th. And then once you've been selected and you are attending PCBI, every session, every month, there's a survey that's sent out to collect your feedback and input. We want your input on this. You guys are experts in your own right. And we really want to have your feedback on this. Again, 100% participation and attendance is expected. We certainly understand emergencies arise, personal or work or otherwise. And we just ask that you notify us in advance when those things happen. Another nuance to that is enrolled participants only may attend. So let's say you have an unanticipated event arise. You want to send one of your coworkers to PCBI so that you don't miss any sessions. We do not allow that. We want people to be able to attend 100%. And if you can't make it, that's okay. Just let us know. You will still receive all of the materials and information in that regard. So just a few key upcoming dates to reiterate. October 9th is the deadline to submit the interest survey. November 1, participants will be notified of their selection. Sometime between November and January, we will begin registration for the selected participants, which will include payment of the registration fee. And in March 12th to be exact, is the kickoff. Thank you all. I really appreciate it. We're very excited to start year 2 of PCBI, and we're looking forward to reviewing your interest surveys. Take care, everybody. Have a good day.
Thank you.